so in this study, which was a retrospective study looking at close to 1,500 patients from the Flatiron database, patients who had had prior sacituzumab showed shorter progression-free survival compared to patients who had not been exposed to that ADC. What this suggests is that there is some degree of cross-resistance between ADCs that both have anti-topo-1 payloads, and when used in sequence, even though they're targeting different receptors on the tumor, the level of efficacy goes down. So this is a tremendous clinical challenge in that we have now 3 approved ADCs in breast cancer, and prospective studies are underway in terms of understanding how to best sequence these agents. The most important takeaway from this retrospective finding is for clinicians and patients to know that typically the second ADC tends to have less clinical efficacy, particularly when the topo-1 payloads are the same. Regarding the finding of patients with BRCA altered tumors or having BRCA germline alterations having less robust progression-free survival, this is indeed an intriguing finding that does need to be validated in other studies. We are finding that, for example, in the Destiny-06 study, the opposite finding was found in patients with BRCA tumors. So I would say this is an exploratory finding that does need to be further investigated in other studies. Regarding patients with PDL negative tumors having a worse progression-free survival, I think this highlights the limited targeted therapies and limited responsiveness potentially for this subgroup of triple negative tumors that tend to have more aggressive biology, less robust treatment outcomes. So again, these are all exploratory findings that do need to be further looked into. Yeah, so the question of the biology of how we sequence ADCs is currently under intense scrutiny and investigation. Yeah, so there's lots of hypotheses in terms of does it make sense, which one comes first. It comes back, the reason we don't know the answer is that the resistance, it's unclear if it's coming from the receptor on the tumor cell, or is it related to the actual payload. And so the T-DXd study is a prospective study that's being conducted out of the Translational Breast Cancer Consortium that is specifically looking at how we sequence and what the biology of resistance would be. So in this study, patients get randomized to start with one Dato-DXd, which is one type of a topoisomerase inhibitor, and then at progression, they go on to receive T-DXd or vice versa. So kind of understanding these sequencing strategies is an important question, but we don't have answers to yet. I think it's really important to not specifically alter treatment practices based on these exploratory findings. I think it's important for patients who are candidates for trastuzumab, deruxtecan, to receive it, and patients who are candidates for sacituzumab. I think it's important for patients to have the opportunity to experience both ADCs. So I would not necessarily alter treatment patterns patterns. However, I think it's important to know that ADC2 tends to have much less robust outcomes, and to prepare patients and perhaps do shorter interval scans and much more closer monitoring when patients are being offered that second ADC in sequence.